we'll start with Anne. And you would want to kind of touch upon ADHD, and then we'll kind of, weave the whole thing around menopause after that.
Yeah, well, I started hearing about the intersection of perimenopause and ADHD when I started out with Hot Flash Inc. And, reading that a lot of women experience for the first time, maybe the symptoms of ADHD, sort of realizing the internal chaos and the difficulty organizing and, um, along with brain fog and a lot of the other cognitive issues that can happen. And I was really interested in it. I have a girlfriend who was diagnosed with ADHD in her teenage years, and she's really classic ADHD.
Hmm.
And at the same time, everyone sort of started claiming that they had ADHD and
Hmm.
using that diagnosis in a lot of their languaging, and a lot of people were creating Instagram accounts, and it became like a badge you wear, like, I have ADHD, and I've met women that have had an ADHD diagnosis, and ADHD is their reason for everything that's going wrong, perimenopause or otherwise. And my experience with the friend I had was that she had never done that, and along the way, I was complaining in my late 40s that I have always been an incredibly organized person, and when I switched from full-time work to becoming a freelancer and managing different projects, I feel like that was the last time I was organized in my life, probably about 7 years
Hmm.
ago. And
Hmm.
slowly, including while I've worked at the museum and worked on their accessibility package, which has a lot of accommodations for neurodivergence and ADHD and sensory issues, have come to realize that I probably have some of this. And I feel pretty confident that I've struggled with it much of my life, but it blew open in my late 40s, which is when I kept hearing that everyone else was. And when I talk to my girlfriend who has ADHD, she reminds me that she often said, I think that you have ADHD. But the only reason I
Hmm.
don't think is because you're running a whole newspaper department and you're so organized and I'm not. And at the same time, my best friend, who is exactly like me and grew up in the same street with the same angry father, with the same fear that we had as a child, is having the exact same issues as me. So I don't know if it's just this whole schmozzle in my life. And I've just sort of gone through this journey of realizing that probably I was exposed to trauma as a child. I know that sounds so everyone was, but that changed my brain in ways. And then I've just been sort of unpacking that. But also, I'm not interested in spending the time to get an ADHD diagnosis or spending the money or wearing it as a badge, if that makes sense. I'm very interested in how my brain works and me and my best friend and then other women that I speak to, but I'm not sure that I want to make it my personality. And so I'm so interested in the intersection of trauma, perimenopause, when your hormones start to recede. When my hormones started to recede, it felt like I was just very, very vulnerable and almost like I'd taken off a layer of skin. So that's where I'm coming at it from. It's still all tangled, as you can imagine, but that's
If we go back to when was the ADHD checklist, when was this designed? Let's say about 60 years back, 100 years back, maybe even less.
Yeah, and the thing is that it was always boys, right? And the way it's been explained to me is that it was always boys and it was hyperactive boys. And
Hmm.
the things that have really chimed with me are that for women, a lot of the times the hyperactivity was in their mind. So, as I've come to realize that my brain which is so overactive, it didn't accommodate women at all. You wouldn't be diagnosed. And I'm glad I wasn't diagnosed, by the way. Like, I'm glad that I didn't, become a kid who had a diagnosis. Not that there's anything wrong with that. But yeah, it's a very old thing, but it was focused on boys. And I think a lot of girls were experiencing that when they were young, but they weren't spotted the way that they might be now.
Since I've started to read about it, and since I've started to kind of speak about ADHD, now even I think that even I've got ADHD, right? It's one of those things. Now when you look back, let's say 50 years, 60 years back, there was no checklist that was diagnosing ADHD, right? And who were these people? These people were the best of the soldiers. They were the best of the dancers. They were the best of the musicians. They were the best of the artists. They would best of the poets, best of writers. So then probably somebody came through and said, okay, this is the societal framework, and anybody who does not fit into this framework would be diagnosed as somebody who is, an outcast, probably.
Yeah, I like to think
So,
of it
of
as
course,
everything, like the spectrum of sexuality, the spectrum of the way people's brains work. And we
Hmm.
know that there are so many benefits that come with whatever this
Yes.
not being in the center is, right? Like I am
Yeah.
incredibly driven. I have insane hyper focus. I have a lot of other things that would drive you nuts if you hung around me, but I wouldn't change it for the world. So I agree with you that we're just starting to realize that normal is, it's all relative. But I
It
agree.
is. It is. It is. It's just your personality, whosoever you are. What's your thought, Kiranji, about this? Now, Kiranji specializes in something that she can actually look at your astrology base and she can actually construct as to what your personality is going to be. So, probably somewhere you would be able to kind of construe, or you will be able to kind of look at that. Yes, are you supposed to be this hyperactive, or is it something, that's a societal damage that has happened over a period of time. Why I say damage is, if you look at Japan's PM's statement from, I think, 3 days back, she wants to normalize that, yes, you get 2 hours of sleep and that should be okay. 2 hours of sleep. She wants her government officials to start attending meetings at 3 a.m., 3 a.m. in the morning. That's night, midnight, obviously. Your brain is you are in the deepest of the sleep at 2 a.m. and she wants somebody to come to the office at 3 a.m. So what the world is trying to figure out is, the world is trying to, kind of put into places that it's okay. It should be manageable. If you're not able to manage with 2 hours or 3 hours or 4 hours of sleep, that's your problem. That means there's something wrong with you. These guys can be statistical anomalies, but that's not normal human behavior. So, Kiranji, I mean, what's your perspective to it?
Harmanji, according to me, first, if we are talking about the symptoms of ADHD, right? So there are so many things like restlessness, lack of focus, hyperactivity, impulsive behavior, so many times short tempered. And these are there are so many symptoms, like more than 70, if I'm not wrong. Though. So in this hyperactivity, these all infected by one thing, that is our energy.
Hmm.
So, if our energy is not balanced, according to me, if our energy is not balanced, so we can't channelize our work, we can't channelize ourselves, we can't do anything in a perfect manner. So according to me, everybody, like if we are talking about sleep pattern, we doctor advise us to just take to 7 to 8 hours sleep to to balance our energy, to give a proper rest ourselves. But for, like you are saying, that 2 to 3 hours sleep is good,
Hmm.
but it's not possible. We have to give in a proper manner. We have to channelize our energy. It's not like that, because if we are talking about our astrological signs, there are 9 planets. So
Hmm.
each planet has its own identity. Each planet has its own energy. Like if we 5 people are here and we are from different fields, so we
Hmm.
all have our field. We all have our interest of area. And due to some single energy connection, we all are here.
Right.
In the same manner, planets also have energy, and they affect our life in a very strong manner. Very strong. We can't avoid that.
Hmm.
Like जो भी होना है वो होके रहेगा, but कैसे, उसके लिए हमें फोकस करना है एनर्जी.
So what
It's okay.
Kiranji has been trying to put across is that, just like all of us have our singular energies, and when we come together, we've got a collected energy, right? And that somehow is going to play. So ADHD is not just a physical thing, but it's something to do with your energy body as well. Now, giving it a Ayurveda yogic sort of a lens, Divyaji would agree with me that Vata imbalance is the one which is kind of causing this hyperactivity in your mind. I'll tell you how my mind works, and I'm not putting any labels here. At 11 o'clock in the night, if I'm really working on something, at 11 o'clock in the night, I have a fountain of ideas, fountain.
So it
But at
means
that particular time, I don't have the energy to put that fountain into a bucket and probably, put it into a diary, put it on a paper. So all those ideas are lost. And whatever remains till the morning, I somehow have the energy to kind of put it on a diary. Divyaji, what is happening in this case?
So yeah, as we are talking about the ADHD, so I was just hearing to both of the ladies here. Anne and the Karen, keeping, I just want to have a continuity with their perspective before I coming to your point. So ADHD, when we talk about hyperactivity is one thing, right? So how we are calculating the hyperactivity, right? We are majorly like, normally we calculate the hyperactivity through the external actions.
Hmm.
But if as we are specifically talking about the woman case scenario here, in my experience, that hyperactivity translate into a woman in their inner world. They become
Hmm.
restless. They are more
Hmm.
of the guilt driven, right? They are more shameful. They are, more anxiety. And this is all happening. They feel overwhelmed most of the times. And this
Hmm.
is every action, every emotion, every action is happening within them. It is not probably not showing up. It is showing up out as an irritation, frustration, right? But
Hmm.
lot of things happening within them inside.
Hmm.
Okay. So definitely the imbalances are there. Right. So we all know the progesterone go down, estrogen's levels go down here and there. It also starts affecting on the hormonal body. It starts affecting the dopamine release also. But as like the Kiranji has just talked about the energy, because energy is one of my most fascinating area of learning. I love to understand it more and more. So yes, the energy is, and when you are not perfect inside, how it is
Hmm.
possible that your energy field is going to work properly? And then when this all these imbalances happens, as we have we are not different from the nature. We all know that nature has been made of the 5 elements.
Hmm.
Humans are also made of those 5 elements: air, water, sky, space, like all those five. That's the point ki like Vata imbalance, that's an air element. That particular element, when gets disturbs in us, it's like how the air is. It just takes away everything, right? So that is what happens in our system also. When the air gets imbalances in us, it is just not creating disturbance in the physical body in terms of the joint pain and all that. It actually is creating lot of emotional up and down also. And
Hmm.
when the those emotion is so subtle that it can't be seen, it can be only felt, right? That is why I always say that if somebody is saying something like, I am feeling this way, don't argue with, you are feeling wrong way, because the someone is feeling in that particular manner, right?
Hmm.
So feelings can't be argued with. And this up and down of the feeling, which women experience in the specific this menopausal or the perimenopause period, Vata imbalance surely plays a great role. Here, like the kind of work I am doing, in my experience, I have seen that the nervous system regulation really helps a lot. All those when we practice, this like I say that the breath is something we are doing the moment we are out, like from the day of the conception. We are breathing, we are breathing in our mother's womb through the umbilical cord, and afterwards we are breathing ourselves, right? But we are breathing all the time and we pay just zero attention to it. Why? That only if we start focusing on our breath, I have seen the miracles happening. That how it is easy, that nature has given us every tool in our hands. We just need to understand how to use it. The breath is one of them. Only by the
Hmm.
breathing practices we can actually regulate many things on our system. So
So
yeah, I
basically,
mean,
what you're trying to say is that Vata imbalance is the one which is causing
correct.
hyperactivity in your body, as per Ayurveda, as per yoga, and we should aim at stabilizing Vata from the Ayurveda perspective, from the yoga perspective, right? But actually, Moheba, if we start to kind of look at the generational knowledge that you bring in, how was it construed, let's say in your childhood? Did anyone complain that they've got hyperactivity? Did parents complain? Was there any societal outburst to hyperactivity or something like that? Was it like that ever?
Unbelievable. Unbelievable that ADHD has come so late in my own knowledge, in my own culture. It's only in the last few years that
Hmm.
we started hearing the very ADHD and what
Hmm.
they stand for, what these four letters stand for. Very, very recently. And all of a sudden now, everyone is talking about ADHD. I think I've got ADHD. And I think my son has got it. And
Yeah.
certainly the neighbor has got it. And what about your grandmother? She's passed away, but she must have had it. What has happened? I haven't got a clue. Someone may inform me what it is. I thought it was associated to the fact that I became a coach 5 years ago and that I started hearing about it. But I don't think that it is only this, because people around who had never ever mentioned ADHD are now talking about it. So it's something very recent. What we used to talk about is, stop it. You've been fidgeting all the time. You're moving too
Hmm.
much. My God,
Right.
this child doesn't stop. It's like, and I know we will be talking about it. It's like burnout is a new concept. We used to say,
Hmm.
I'm so tired. I'm truly exhausted. I went to sleep and I can't. So there are concepts that were there as realities, but they were not there as concepts. They had not acquired the value, the recognition of being something in its own right. And that is ADHD. And I
So
was
this is
listening.
basically a new concept that you want to say. This is a fairly new concept. It's not always been there, but somebody is trying to push the idea that yes, ADHD is becoming an epidemic, and they want to kind of push the bracket of epidemic. Correct? That's exactly
Push the
what is
bracket
probably happened.
of abnormality, ADHD. So it's a sickness. It's up, and people who have come to know more about ADHD would simply say, and this is what I like to think when my clients talk to me about their child who has ADHD, what can I do to make her normal? I say the best you can do for her is to consider her normal.
Normal.
That's the best
Absolutely.
way you can help her. Just deal with her as a normal child. She is normal and things will be great.
Perfect. So, in your opinion, and I mean, the point that I raised, I want to have your perspective. Is it that the Western medicine is trying to push ADHD as a mental epidemic, a mental health epidemic, just as they pushed cancer, just as they pushed diabetes, just as they pushed every other big big pharma, disease in the world? Do you think that's possible?
I think that might be a little simplistic. I have quite a few teachers in my life back in Canada. My brother and my best friend are both teachers in primary school, and they talk all the time about the issues with the kids and how much worse the kids are and how they have to have all these accommodations, and they're
Hmm.
clearly struggling with something. Like, this isn't a child that's normal. These are kids that are placed in their classroom that have to rub against something all the time. Like, there's something serious going on. And I know my brother and my best friend both have thoughts about parenting in the West and how people are parenting, but I don't think you can say it's as simple as that, because something is clearly going on. But I think it might be complicated by all the things that are going on, say the rise in autoimmune disorders, where you can't really separate out how different our modern life is, how confusing, how many environmental toxins, how many chronic stressors that we face that we didn't face before, and how all these things might be contributing. And I'm really interested too in the difference between generations, because, I've been thinking a lot about my parents are both gone and how much pain, like we called it the boomer generation, how much pain they were in,
Right.
but how unaware of it they were. And their parents, how unaware of it they were, and how my generation, Generation X, is becoming aware of it. And I can actually see, in my niece and nephew, like they're so much smarter, better little people in their teen years because
Right.
of how they've been parented by my brother who's done different things. And so I don't know. It's like, I don't think like anything we talk about these days, it can't be one thing or the other. There are so many,
So many
many
aspects.
things
So
going
many
on.
aspects.
But certainly many people have put out their shingle. It's become their whole business. And it's very seductive when you come across these reels on Instagram or TikTok that are talking about the pain that you felt inside and how you have felt inside. And it often goes beyond like disorganized thoughts into some of the traumas and emotional vulnerabilities that you felt. So, in a way, I think it's a good thing. And in a way, I think it's gone like really, really, really too far.
So what the point that you making is that yes, of course, the present generation of kids and parents as well, they're more aware So they look at it through so many filters, and one of those filters is possibly that, your child could be having an ADHD. Then again, I would say terming it as a disorder does the actual harm. There's
Yeah,
there's
but
nothing wrong as far as
I will say there's some kids who definitely have a disorder. Some like their behavior would not indicate is not covered by what we're talking about here. Does that make sense? Like
I
there are
agree.
teachers are wearing gloves with like covered Kevlar gloves in schools in Toronto because kids are scratching. Like this is, things have gone sort of I'm not talking about simple AD. There is definitely an issue. It's not just we're more
It's
aware.
just not okay. It's okay. I agree. It's just not a psychological thing, but there's actually something physically going on here. Could this be again something to do with the excess hormone intake in terms of dairy, in terms of adulterated food, in terms of all this sugar intake, the excess sugar intake, or probably the altered sugar intake? What my parents were eating and drinking in, let's say, about 30 years, 40 years back, things have really changed. It's more chemicalized now, things, right?
Yeah,
So
I
do
think
you
it's
think
really hard to separate out what it could be. And it's not popular to criticize vaccines, but there's a lot of parents who, kids are already, the way it's been explained to me is kids are already coming into the world with a major toxic load from a mom that has a toxic load. And I am talking about it in the West because I don't know what it's like in India, but I know it's a problem here. And then so they're coming in with a toxic load, and then they're given a really high number of vaccines when they're a child. And this can sort of tip them over. And another child who didn't have that load might be just fine. So that is becoming more of a mainstream, albeit very controversial topic, but it's something that the US
Hmm.
Health and Human Services has addressed recently, and Trump has been called crazy for endorsing it. But I don't think that you can deny that that is also an issue, but you can't separate it out. Diet, sugar, overstimulation, kids raised with screens from them when they were babies. It's all, there's so many pieces to it. Everyone is over hormonized, right? We live in a plastic environment with endocrine disruptors. I can't say it. Endocrine disruptors.
EDCs, EDCs,
Yeah. Yeah, I can talk. So
EDCs?
that's another problem. There's just so many, right? There are just so many different things contributing.
All right. So, coming back to you, Kiranji, what is your perspective? I mean, you've been seeing a lot of clients. You've been seeing a lot of, I would say, patients who have come to you asking for help. Of course, a couple of them are also coming in with mental health issues. I'm sorry. Do you think that we can go back to the Vedic system and probably scope out something that, could be possible? We are missing in the modern world. There's something possible to kind of dig from there.
Uh, the thing is कि Vedic astrology has the roots. It has energy. Everything is has energy. इसके लिए हमें क्या करना है? Astrology analysis. For this, we can do astrological analysis. We can check if a patient is coming to me, whether it is a child having an age of
Hmm.
40 or it is a menopausal age or any age group. First, I looked into their chart, their Lagna chart, their birth chart. What is the planetary position in it?
Hmm.
Because I know each planet has its own energy.
Right.
So
Right.
we look into that. Kya karna hai? Which planet is going to imbalance their energy? If there is a moon conjunction with Shani, then definitely there is
Hmm.
lack of we can say there is insomnia, there is hot flashes,
So
we
basically,
can
there's
say
lack of stability.
hyperactivity, lack
There's
of
there's lack of
stability.
stability, right? So stability in mind, stability in action, stability in your lifestyle, and there's always a lot of scatter with such people.
And with the help of their birth chart, we can identify what is the root cause and what is the solution for that.
So basically, see, going back to the Vedic science, Mohiba, you would, really appreciate, and even if you would appreciate, I mean, we keep hearing of all these things day in, day out in India, but this is a new perspective for you, probably. In India, we look at solving or going to the root cause of a certain problem from so many angles. So medical is one, your energy is one, and what the cosmos is actually playing. which is going to affect your energy eventually, is also one of the aspects. So what Kiranji has been doing over a period of, let's say, past 20 years is this, that she has gained sufficient, I would say, experience in solving such cases, such disorders, if I may say that. Then she's able to figure out that, is it something to do with your physical aspects, or were you born with a certain, set of stars that had, as they say, fault in our stars, right? So is this a fault in your stars, or this is actually a lifestyle issue that's probably going to come? The hyperactivity, the disorder nature, the unorderly nature. Even I have a lot of scatter right now around me. I don't want to show you the camera on the other side. But yes, there are so many things that we can do. And so one probably vaccine from Kiranji, one from Anne, one from Mohiba, and one from Divyaji. Divyaji, what are okay, we've seen that ADHD is a lot to do with expectations, the societal expectations not being met by a certain individual, probably. That's how you labeled as one. There's something that keeps setting inside you that probably provokes. Okay, I'll ask you a question, all of you. If you look at disabilities, you've got somebody who doesn't have a hand, you've got somebody who doesn't have a leg, you've got somebody who can't see, you've got somebody who can't hear, and you've got somebody who can't speak. Which one is the most, I would say, most frustrated person? What do you think, Divyaji?
I mean, if I have to answer this question, I would rather not, will be saying that this person is more frustrated, or that for that disability can bring more frustration. Let's look to this disability concept from a different lens. I mean,
Okay.
I always choose to look from this perspective. What exactly the disability means? As you were just talking about the societal structure, or in a certain kind of structure. So how we define the ability? The ability is, again, itself is a complete structure, right? Why I have, this is example I would like to, this is my experience with one of my friends. She has a daughter. She is autistic. All right. So we were just discussing one day. We it is like autism. What exactly the autism? Autism is a big umbrella. Okay, wherein one DNA, one small thing has gone, one atom has gone here and there in your spinal cord, and it has created a lot of issues in the system. Now, when we say issue, so that particular thing is disability for us, for my friend, or for me, only because it is not falling in that set structure of being not issue or being able. But we don't see that the person who can't see has an increased sixth sense of hearing, right? We don't understand that the person who has not the hand has a much more strength in their limbic, in their limbs,
Right.
in their legs. They are doing everything with the help of their legs. We just cannot understand that the person who can't hear has a much, much, much more better understanding of the music. Because when ears are closed, we are just shut from all the noises. Then the interpretation of the music becomes very different. When I'm just not able to see, my interpretation of the listening is very, very different. So what is exactly, nobody is frustrated here. They are, if as in a complete human with two hands, two eyes, probably I will rate myself as the most frustrated. Of course.
Why would that be?
That is because that's I'm reaching here, because I have everything, right? I have two hands, two eyes, and everything. Good body, perfect. Everything is good. But still, I am running after something. They know that they can't see, they can't do this. So what they are working on, whatever they have, like this is what what I say, that it is very important to look in yourself and to understand that how you can. That's why I never use the word weakness. I don't choose to. I always choose strength and the work in progress. There is nothing called weakness. There are areas which are your strength, and there is another area which is work in progress. You can always make it better. So that is what this people does. So why to say disability? Why even to put that kind of things in the category of the disability? So if you
Okay, I'll
want to
give you a
call it,
perspective.
Yeah.
I'll give you perspective. I'll give you perspective. Somebody who doesn't have a limb, let's say, the other limbs, they cope up to do the same amount of work, right? So that's basically your body's trying to step up. Somebody who can't hear is at peace because one of the most annoying inputs is off. Somebody who can't see, again, one of the inputs is off, so they are at peace. But now think of this, and this is where I'm trying to build on what Anne said a couple of minutes back. Anybody who can't speak has got all the inputs, and there's a lot of input, and there's a lot of understanding and a lot of things brewing up inside, but the expression is not there. And that person is one of the most frustrated people out of the whole lot. Now, building on what Anne said, there are kids who are eager to scratch. Let's try and see what they are trying to do. They are trying to gain attention. They are trying to put their energy out. Some form of expression has been missing, and this has actually put in a lot of frustrated patterns into that child's psyche. And that is exactly what is coming out. Add on. I'm sorry.
I
Divyaji.
want to, yeah, I want to just add my perspective here. Expression is just not limited what we think.
Hmm.
Expression, in my opinion, cannot be generalized that these are the 10 ways of the expression a person can express. We need to understand ourselves, and everyone does that. Yes, definitely, who is not able to figure it out, that person may need little help to understand that what
Right.
could be the possible way for them to get the expression,
Right.
to get the perfect expression. Saying if a person who can't speak can't express, no, I'm not, I'm so sorry, but I will not agree to this, because if person is willing to do it, that's where the willingness comes in the picture. That once your choice, if you are so willing, if you made a choice that no matter what, let me understand that what is that is going to help me to express myself better. And if you will start finding out in yourself, not outside, right? Like Kiranji and all of us in there in the panel must be agreeing on this, like it is about to figure out what is working for me. What is working for me probably not working for the others.
Not working for
Right? Yeah. So expression is very individual. It's a very subjective. It cannot be generalized. So until unless you are not able to figure out that what is the way of your expression, probably you are a frustrated soul. However, if you are even on the path of finding out that what is working for you, that frustration will come down. Right? So yeah.
What we are trying to kind of establish here is something that, okay, we see that there is no definitive way of understanding that what is it that is causing so much of energy upheaval in that person. It could be hormones, it could be a lot of psychotic sort of a storm inside, but there has to be something that we should be able to do. What's your take at this, Mohiba?
While you were talking about not hearing, not seeing, I was thinking of one thing. Being independent. If I can, excuse the term, go to the bathroom by myself, I don't mind. Other frustrations would be nothing much compared to every time I need to go to the bathroom, somebody has to take me there. That is frustration. I can't see, I will compensate. I will hear. I can no longer write, but I can then speak and it will be turned into writing. I do understand and I perfectly agree that when I have one thing missing, automatically the other senses compensate and become so powerful, so powerful. And you can express yourself, you can express your love or your frustration through your gestures. Even if you can't say a word, your face, your color, the facial expression, your fists, your hugging, your tenderness would express it all. You don't need one form of expression. There are other forms of expression. It's the one thing that would definitely frustrate men. And it's this, being dependent on someone for these basic, very, very basic. That is frustration. Otherwise, we can manage. We will always manage, relying on one sense or another. We have enough of them, thank God, to be safe. That's what I'll tell myself.
Now, you've raised a very important point here, Mohiba. Dependence or independence, rather. Not being dependent. Now, consider a lady who's going through menopause.